picture love. So imagine your friends, your family. So when you think of family, does anyone come to mind?
It's still my mom.
So let's check the idea of feeling shame. So how would you put a feeling of shame, something to do with mom?
I think it's still like and
Yeah.
that.
The body always prefers safety and familiarity, even if it's bad, even if it's miserable, because you got through it. It only cares about survival. So it's like, well, we survived that. Whereas if you've never had the experience of acceptance or a loving relationship, the nervous system that's like, I don't know, like that, what if it kills us? Like it's not rational, but that's just how we evolve. Okay.
So
Yeah.
thank you for coming. It was really glad that Kim can come. And could you introduce herself?
I mean, well, I started first as a chiropractor because I thought that as far as like doctors or that kind of health practitioner goes, I felt like chiropractors seems like they had the most freedom. Oh, you can, set your hours and everything. And it seemed so simple. Like you learn these 24 bones and you line them up and then people get well. But then, once I got into practice, I
It's not.
discovered, right, it's not that simple actually, that there's a lot of things that can affect the alignment. I'm fortunate that I was exposed to things like NET early, and I found that that kind of approach really helped release my things that I thought were structural, but then it turned out
It was
that it was
emotional.
emotional. And it was just, it really blew my mind to feel that physical relief after like a mind body type of intervention. So I felt like early on, I felt like, wow, I have to learn to do this because that's how I wanted to help people. Now it's almost 30 years into it. So now I'm like really focused on the NET because I feel like there's 300 chiropractors in the city and most of them are pretty good. So there's a lot of good chiropractic all over the place, but there's not as much of things like NET. And I feel like people are really struggling with stress and trauma and
Especially the city.
yeah, it's intense in the city. So yeah,
Yeah.
so I'm focusing a lot on the NET part. And then also in the last few years I've been writing more. So like I have a new book coming out in December.
Congratulations.
Yeah, thank you. So I feel like as I get older, I wanted to kind of build something into my career that I could keep doing as I get away from more physical work. And writing is something I always wanted to do anyway. So
Yeah.
yeah.
So like the person, like how do people know like I need to go to like a regular chiropractor
Yeah.
or if I like what type of treatments do you use for NET?
Like what NET
Treating,
would be
yeah.
for? Well, the simple thing is NET is for stress related things. So people suspect they could use some NET if they notice that like their pain happens when they're stressed or like the digestion is bad whenever they're stressed. Like
Mhm.
whenever like a physical manifestation happens and connected to some kind of emotional event
Mhm.
as opposed to like an injury or something, then NET usually helps. Or I get referrals from other practitioners. Like a practitioner will feel like something is not resolving like it should, and they notice that this person is also under a lot of stress, or they were under a lot of stress when the problem started. So then they might refer
So
over to me.
anything that is emotion or stress related, it's good
Yeah.
to use
So that's
NET.
like the obvious thing, but in reality, I feel like you never know. Like the patient doesn't know
Mhm.
who they should see, and I feel like sometimes, even as a practitioner, I don't know. Like for myself, I'll often think, "Oh, I'm a practitioner. I know what I need." But then I don't know. You go and see somebody and something totally surprises you. You can never be like objective with yourself. Ideally, in a perfect world, everybody, I think, has kind of a rotation. Like, everybody sees an acupuncturist sometimes and a
That's not correct.
chiropractor sometimes, like,
Yeah.
because just to get that little check-in and that different perspective on their health.
What was like the most surprise case that
I think the most surprising ones are the ones where they don't even tell me what's happening until, like, after. Like this woman, I remember she came in for, like, foot problems. So, we were doing a lot of work with her feet and, doing some NET, and some emotions came up. And then later she Facebook messaged me, "Oh, Dr. Kim, I'll never forget, how much you helped me with my stomach stuff." And I was like, what stomach stuff? Like I kind of was like, "What?" And I, looked at the notes and I didn't see anything, and she didn't say anything. And she's like, "Oh, I never told you because I didn't think it could help, but I used to have stomach acid and trouble with digestion, and it was so sensitive." Like, she's like, "Nothing ever helped, but after we started doing NET, my stomach problem went away and it didn't come back." And I was like, what? Or another patient, again, we're working on something else, back pain, shoulder pain, like something there. And then she was really excited one day and came in and was like, "Oh, Dr. Kim, I didn't gag when I brushed my teeth." And I'm like, what are you talking about?" And she was like, "Yeah, I didn't mention it because she just had such a sensitive, like this like gag reflex. Like,
Mhm.
she could never get through brushing her teeth without almost like throwing up. Like, it was just for years and years.
So it's like the muscle and nerves are
Yeah,
too sensitive
yeah.
inside, and then when you release the tension,
Yeah.
it
Well, it was connected to some
becomes
trauma. So while we were doing NET and getting to the bottom of like this, yeah,
yeah.
this tension, it went back to like a specific trauma that then it was the same trauma connected to the sensitive gag reflex. So it was just like, yeah, when people are like, "Yeah, thanks for helping me with this," and you're like, "I don't even what?"
We had an interview with a psychiatrist the other day, and she does
Mm,
hypnotize
mhm.
and also the tapping.
Yeah.
And she said, like, it was also like years and years ago, like in the East. And she said she didn't thought of hypnotizing can help with infertility.
Mm,
And
mhm.
she was solving these women's just their family issues. By after that, then they got pregnant because it was something back in the mind that was like, yeah, something was just too intense. So
Yeah.
she couldn't, yeah, it was very interesting about that.
Yeah,
Yeah.
it's pretty crazy, and that's, the fun of being a practitioner is every day is different. So NET means it stands for Neuroemotional Technique. So, see, how do I explain it? It's quickly. Yeah, we could do like a demonstration if
Yeah.
you're being like put on the spot. So
Okay.
the one of the main tools that we use in NET
Mhm.
is the muscle test. So muscle testing is basically it's like our low tech biofeedback. So we're using it to gauge where basically check to see like where is the nervous system at. So we're gonna start to first we just get like a baseline, see like what's your kind of normal,
Mhm.
and then we present some type of a stress, some type of a problem. So it can be a body area. So if you're having like a pain or tightness or somewhere in your body,
Mhm.
we could start there.
Mhm.
So do you have a
Yeah,
body or?
my hip,
Mhm,
my groin area. Like
mhm,
I can't close it in. It's like it's pinched. Like the day right after I landed in
mhm.
LA, this started.
Oh, wow. Yeah, so that's a good clue because it sounds like,
It could be.
I didn't do anything, but that was a big move."
I'm not sure if there's like the bone alignment, but
Yeah,
also it could be a lot of stress. So
okay.
yeah.
Yeah, that would be a good one. So go ahead and hold this one. I'm gonna push here and you
Mhm.
just hold steady. I'm just checking what your like normal muscle feels like.
Mhm.
And then I'm gonna touch between your eyes and keep holding here, keep holding. So is that water?
Yes.
I would go drink a little bit of water. And keep holding here, keep holding. Yeah,
Mhm.
that feels better because you were testing a little bit dehydrated. So go ahead and hold where you feel like the tightness. And so hold here, and then I'm going to touch your forehead. Hold. So hold. So this is like your normal baseline, but when I touch here, hold, we lose some strength there. So these are the emotional points. So
Mhm.
since it changed, that means that there's some kind of stressor there. So whenever there's stress in the body, it's usually basically two things in life that can cause stress in the body, two main things. So it's usually either love or money. So
Mhm.
love means like all It's the world of people, relationships, friends, family.
Mhm.
Yep. And then the other one is money, which is all the material things in life, money, job, career, finance. So the money side tests pretty stable, but picture love, which is family, friends. There it is. So we're going to subdivide that. So imagine your friends, your family. So when you think of family, does anyone come to mind?
It's still my mom.
So picture your mom. Yeah, it's mom. So I'm going to check some pulse points. Keep thinking of mom and mom and mom. There it is. So this can rest, and I'm going to say some emotions that go with that point we were on. So let's check the idea of feeling shame and your feeling. So relax. So how would you put a feeling of shame, something to do with mom?
I think it's still like coming out and all
Yeah,
that.
yeah,
Yeah.
yep. So picture that shame feeling like coming out to mom. Yeah, there it is. So you're going to go ahead and take this hand and go around and hold one finger here and this one on the forehead. And you're just going to breathe nice and deep and just stay with that shame feeling of like coming out to mom. And you're just going to keep that feeling until it fades a bit or becomes hard to focus on.
Mhm.
Okay. So go ahead and hold this one, hold strong. Good. And then picture that feeling again and mom. Good. And then hold again 2 fingers like this. Good. And then relax this one. And then actually go hold that point we started with and then hold this one. Good. Good. So now we're getting a stronger test,
Mhm.
whether we do this or not.
Mhm.
So that means we cleared like one layer off of that. So I don't know if it feels any different when you
It
move it.
it's like slightly change a bit.
Yeah.
It's not as hard as it was.
Yeah, so it's a little shifted. Yeah,
Mhm.
so that's an example of what's called the 2-minute version of NET, where we just go really like focus
So
on a specific thing and just like clear the most recent piece of it. So if we wanted to expand it further, then we would have done some more muscle testing and gone back in time and try to find the earliest time in life where there was that same feeling of shame
Mhm.
of having to like reveal something about yourself to someone.
I saw like on YouTube they're like from
Mhm.
10 to
Yeah, yep,
20
yeah, 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 yeah,
and then 10 to 15
yeah,
and then 11 years old, 12
yes.
years old, something like that.
Yeah,
Yeah.
yeah. So you can use the process to go, deeper, 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 deeper. And then when you find the earliest one, right, clear that one. So then whenever, and then, depending on the plan or the problem, it can expand from there. So, for example, if this is a big kind of recurring theme for you that comes up in a lot of the work you do, a lot of stress with mom, then there's other ways we can access it. The one example would be like holding your arm and saying something like, I'm okay with mom, and then we muscle test. And then if it goes weak, it means that even that idea triggers like a stress response in the body. So then we would use NET to help settle it down so that your body can just be more relaxed with the concept of mom, regardless of if she's accepting, not accepting, like your body can be grounded. And like with the hip, so a lot of times emotionally, it's about moving forward in life or stepping forward to the next thing. Since it's testing stronger just by holding it, you could also muscle test by putting it into the stressful position and muscle testing and seeing if something comes up, or standing and doing a range of motion and muscle testing, or holding one hand on your like back where the nerve to the hip goes and see if this one connects. So there's all different ways you can access and see if there's an emotional thing that comes up. So a lot of times in the beginning of the therapeutic process with NET, it's like whack-a-mole because it's like, oh, here's one, here. It seems like random triggers, but then as you open them up and see where is it coming from, what's the feeling, usually a common theme starts to emerge. It's like, wow, all of these are about mom, or wow, all of these are about self-worth, or like some kind of pattern. So when you see the pattern, then you can go back and focus on the pattern, and then the body will naturally heal the things along the line. Yeah, but NET is it's very gentle, it's pretty non-invasive, but it goes direct to what it is. It's kind of like that game 20 questions. You start big and then go small. So it's like we started love, it's all the people, relationships, it's this whole world. and then money. It's a whole material world. So you start like this or this, and then okay, it's here. So then okay, within this one, there's friends, family, partner, and it went to family, and then family is like okay, it's usually a mom and a dad. So you start, and then it's so it just it gets like narrow and narrow, and then depending on the we were on this point,
Mhm.
which with NET it goes to like governing vessel, conception vessel. So the feelings that go with that is going to be like shame, arrogance, false pride. So it's just like a narrowing down. So depending on like what point it goes to, that determines what emotions we start to, and we just follow the muscle test. So I like NET because it can take a complicated thing, but it's a simple protocol. So it's not dependent on like my powers of intuition or anything. It's a protocol. It's like here's the steps, follow these steps. The breathing is important. So you're breathing slowly. So slow breathing is another thing that tells the body that it's safe. So it's mixing like safety physiology combined with touching the points, combined with imagining the trauma or the stressful event. It's the combination that then like settles it down. So what it does is it helps your body just be more relaxed when it's faced with the trigger. So, I have a similar mom, so I've had a lot of NET on mom stuff. So even though mom is still mom, like we still have conflict, I don't feel the same way in my body that I used to. Like I can be around her and feel more grounded in myself and not just like I'm 2 years old and I'm, jumpy or scared or whatever. So even though there's still stress, in the relationship, I don't take it on physically like I used to. Like I used to, always have a headache or get a like migraine trigger easily, or I just feel like get sick all of a sudden, but it wasn't real sick. It was like just emotional sick, I think. Having all the symptoms, So it used to be really intense. I feel like I feel like most sicknesses have some emotional
Yes.
component to it. I don't know that anything is 100%. Yeah.
It's a lot. I believe there's a lot
Sure.
because people I see, if you ask deeper, then there must be something.
Yeah.
There's always something
Yeah.
triggering them. It goes with yeah, either family or
Yeah.
or work stress.
Yeah.
And most people don't really connect these together. They think,
Mhm.
yeah, I can handle stress. That's just
Mhm.
life. Everybody's
Right.
like that. But
Right.
they never thought that that's really making them even sicker.
Right.
Yeah, like with your patients,
Mm.
are there more men or do men hide their emotions more or
Yeah, of course. Yeah, I think my practice is probably 90% women, not because men don't need it, but they don't get it. Like they're not conditioned, like culturally, they're not really conditioned um, to handle or
expose
express
their
or I
yeah,
mean, men don't go to the doctor in general anyway as
yes.
as much, so they tend to neglect their
They
health
think they
stuff.
can work it out
Yeah, power
themselves.
through it.
Yeah.
Yeah, so not that many men voluntarily come in. I mean, usually they've done some other work already, either they've been in therapy, so they're comfortable, like they have the language and everything. If we're doing our testing and it's like, well, this one looks emotional, then they would be like, okay, fine, let's see what that is. So as long as they're open and willing, then it can go okay. But sometimes women too, but more with men, don't sometimes they don't wanna know. Sometimes they're like, "You know what? I don't actually care. I don't care if you have to crack my neck forever, like, I don't care about the emotional part." So sometimes they don't wanna know, and that's okay. It's their bodies. It's your body, it's your path, it's your life. Yeah. But I feel like younger males are a lot more comfortable talking about their feelings and emotions and their problems.
The society now, they're more prone to going to a
Yeah,
therapist and they start now people know emotion really connects to our
yeah,
body.
yeah.
So
Because the kids
it's
see there's even movies like
yeah.
the Inside Out movie and stuff. Yeah,
I think that's a really great movie. It
yeah.
helped a lot of people. You sent me the chart yesterday,
Mhm.
and I kind of looked through it. It's related to the elements,
Yeah.
the organs, and these are where we usually feel the pause.
Mhm.
It's the same. And like what we do, we do the tongue and pulse checking,
Mhm.
just seeing the tongue, see your body is more hot or cold,
Yeah.
or there's dampness inside. And by feeling the pulse, you know which organ is affected, and then like which energy is weaker. So I think that's pretty much what you were always also doing,
Mhm.
like
Yep.
which point and then
Right.
the energy.
Right.
But this is so much faster.
Yeah. Yeah, it's very fast. Yeah. It's pretty
Yeah.
crazy.
And our pulse, like with our pulse, there's like 28 different pulse,
Wow.
like with 6 organs,
Mm.
and with different the shape of the pulse,
Yeah.
the deepness, the intention, the tensions,
Yeah.
and that will tell us like is there like, "Oh, you're pregnant. You're having a baby boy."
Yeah.
It's a bit different, but you will know like you're having you might have like some sort of digestion problem, and it might be you're having constipation or something like
Mhm.
that. Yeah. So we go through that and then to find like
Yeah.
what's the root of the problem.
Yeah.
But I'm
I'm always amazed that acupuncturists can really feel all those, like, subtleties in the pulses, like, "Oh my god."
But
It's
I'm
crazy.
also this is just a 2 minutes, but if they have, like, a deeper trauma
Mhm.
or something, how many treatments do they need? Or usually,
If
like,
it's
how's the
deeper, like, on the average, I've found it takes about 5 sessions of about, like, roughly 40, 45 minutes or so. That's the average, and the way it usually goes is, like, that first session is really like that whack-a-mole, like, "Oh, here's one, here's one." It's like this patting out the fires, and then as you're moving on, the second one is like it's like, "Okay, now we're finding a theme," and then you're, like, focusing on the theme, and then you're, like, kinda going over the hump. So as you get over to like that, like, fourth visit or so, it's like you're not finding as many problems. So it's testing a lot cleaner.
mhm,
So then as we like get over it, then instead of like focusing on the problem, we focus on the positive thing that they want. So building the resilience so that when a problem hits, they just kind of can like flow with it instead of like going down. So that's the average.
mhm,
And in the research, there's some like fMRI research with NET. That's about how many visits they found to the average was about 5. In the research, it was like 5 1-hour sessions, but
mhm.
that's like the average for like a focused, like a big thing.
And after the treatment, how do they maintain that? Or is there
Um,
anything they
so
need
if
to
if it was really from an old thing, like it's just the old thing, they don't have to do anything. It's just done.
it's just
So
you just acknowledge.
it's a lot harder if there's like ongoing trauma, like if they're right now in an abusive relationship or right now, like that's you can't just like
Mhm.
fix that. But if life is life. It's pretty good. It's all right. But this unresolved stuff in the past, that can definitely be
Right.
better.
Just like there's a bug inside and they just need to debug that
Kind
program,
of,
and then
yeah.
it's gone.
Yeah, it's like the body, there's a part of the brain that thinks that threat is still happening, and it thinks it needs to keep responding, protecting you. Your body always thinks it's doing the best it can for you, so it always thinks it's helping you, protecting you, so any T helps to let it know, "Thank you, that's not happening anymore, I don't need that." Yeah.
Mhm. Okay.
For example, let's say there's a pattern of, um like fear. So in the beginning, we might work on clearing the fear response, like, picture the fear or clearing it. So then as we clear over, the positive opposite side of that would be feeling courageous. So like saying like I'm okay being brave or I can feel safe. I'm strong enough or I can be supported. Like what's the positive what would it look like if you didn't have that negative? It would be, the positive side. So if somebody is clearing like rejection, like feeling unlovable or nobody loves me, nobody wants me, nobody likes me, then the positive side would be I am lovable. I do have friends like people I am valuable to society or
So it's more of like telling yourself that you are good or you are
it's
okay.
not just telling yourself, it's making sure your nervous system
Mhm.
is at peace with that, like feels good with that. Because sometimes people will just do affirmations like I am good enough, I'm a winner, I'm valuable, I'm worthy. But then their body is doing like a like it's a stress response. So then it means your nervous system is really going to push it away. It doesn't want it because for some reason it's creating a stress. So if that's happening, then we would want to, with the process, figure out, well, why is that happening, and then clear it so that so that when you say, yeah, I am good enough, I'm lovable, that your body can be relaxed, and then allow it to come in instead of like unconsciously push it away.
Mm.
Yeah, and the body always prefers safety and familiarity. So if you're familiar with something, if you're used to something, it's gonna always go that way, even if it's bad, even if it's miserable. It prefers familiar because you got through it. So your body feels like, well, it only cares about survival. So it's like, well, we survived that. I know how to survive that. Sure, let's keep doing it. Whereas if you've never had the experience of, acceptance or a loving relationship or whatever, then there's a part of the nervous system that's like, I don't know, like that might, what if it kills us? Like it's not rational, but that's just how we evolve, you
Does
know?
does NET help with like addictions, like quit smoking or
Yeah, it can. I mean,
like
every addiction is
like
different.
sugar? Like, can it tell your body like because you said it's
Mhm,
used to what it's
mhm.
comfortable. Like
Yeah,
I'm comfortable with having some dessert afterward.
right.
Can I tell my body like I don't need it? And
Yeah, NET is a tool among tools. So there's never like one magic thing that fixes everything. It's just a tool. So in combination with a lifestyle modification, peer support, whatever, yeah, of course, NET will make a huge difference because then you can do either the muscle testing on the statements, like I'm okay without the sugar or without the cigarette, or I'm okay without the alcohol, like seeing like is your body lined up with that idea? So NET can help that. Sometimes you'll think it's going to be a hard one, like, "Ugh, I don't know about this one." And then it turns out easy. And then
yeah.
sometimes it's like, oh, this seems simple, but it's not. So you never know. Yeah, you just never know.
Yes. Yeah. I feel like the sometimes the hardest you feel like it's the easiest.
Yeah,
And it just surprises me. It's like,
yeah.
never thought that I can treat this.
And then they send all their hard friends to you, and you're like, wow. Yeah, they're not all gonna be easy. Like it's hard to live up to your hype then when they're telling everybody that you fixed it so fast. When I was first in practice, just starting, this guy came in and he had a neck problem. He had had it for a long time, and I think I adjusted him once and it fixed it. So for years, he kept sending people in and he told everybody, "Oh, Dr. Kim can fix you in one adjustment." And I don't think that ever happened again. That was like a one-time miracle.
Like you said with the like in the beginning, it's like whack-a-mole. It's pretty much like TFM. It's the same.
Yeah,
Kind if it's sometimes we can really do it at just one treatment, but most of the time it needs like a series.
yeah,
Because your body didn't have this in one night. We can't fix that with one treatment.
yeah, yeah, and just modern life, it's so much input to the body.
Yeah.
It's like, it's chemical, emotional, electromagnetic, like it's a lot for the body.
True.
Yeah.
About the after your afterlife
Oh,
thing.
yeah. So my newer project is called After a Wife. So that's where I'm helping people do living funerals, which is basically putting together kind of a funeral experience for people before they really need it. So
How did you come up with this?
I came up with, it's so weird. Like I've kind of always wanted to do that kind of thing. It's kind of like being drawn to that like end of life, like transitional time kind of focus. I mean, I grew up super, super Catholic, so I feel like Catholics have kind of a death focus in a certain way. So maybe that's where it started. But dramatic ritual kind of experience can be really powerful. But in our mainstream culture, it doesn't really exist. So I thought it would be nice to give people the opportunity to go through like that kind of like dramatic ritual without having to join a cult or get religious or anything, but to kind of explore that because death is such a important part of life. And I feel like we avoid it so much that it's such a shit show. Like when people die, it's like, wow, they didn't do their paperwork, they didn't emotionally prepare any, and it doesn't have to be like that. Like in other cultures where it's not so like avoided, I feel like it can be a smoother transition, or if people felt like more comfortable thinking about it, talking about it, imagining it, like then maybe they would do a better job of making sure, like, yeah, let's get the paperwork in order so that our families are not like fighting and scrambling, and or even just emotionally, so your family doesn't feel like they never said anything or they didn't say anything. Like it just doesn't have to be it'll never be easy, but it doesn't have to be so
So
chaotic,
yeah.
awful like it is. And since I have a temple in my backyard in Sacramento, I thought, why not like use it for this like bigger service to the community, instead of, I've always been very compartmentalized. Like, well, my practice clientele doesn't have to know anything about what I do here in my spiritual life, and these people don't have to know anything about
Yeah.
this. And I just want to live a more integrated life. And I think everybody wants to live a more integrated
Yes.
life. And we're just taught everything has to be all or nothing. Sometimes people are like, they're in their corporate job, and then sometimes they're like, I'm going to quit my corporate job and be a healer, or I'm going to quit my and be like an artist. But like, it doesn't always work out
Yeah.
that way. But it would be nice if people could, yeah, have more balance, and anyone's allowed to do.
You said it doesn't need to be a funeral for someone's dead. It's even
Oh yeah,
like a habit
yeah,
or something you want to say goodbye to. I think
exactly.
that is something that's really nice.
Yeah. Yeah,
Yeah.
because you can honor things, like, even, I'm writing a book right now too about, like, grieving gender transition. So sometimes even, like, your old self, you didn't feel like being that person forever. It doesn't mean you hate them or they're awful and you just never talk about them again. Their dead name and everything. You can you can still honor that person, and you're allowed to have grief and go through a process and still move on to the
Yeah,
new thing.
because grieving process is very important.
Mhm.
Um, like in the Taiwanese tradition, after someone died, they go through a 7 plus 7, like 49 days
Mm.
of like the whole grieving and process and a lot of ceremonies. And I was there for the first 7 days with my uncle when my grandmother passed away.
Mm.
And with that 7 days, we still treat her like she was still there. At like her casket is there, and we have like they're like the tradition Taiwanese the rituals.
Mhm.
So we have like an incense, and then like ama is like grandmother, wake up. This is need to like use a towel, like come get up and then wash your face and then brush your teeth, and then we'll bring
Oh,
like
wow.
breakfast and then like dinner. And before my grandmother passed away, she's like, don't give me vegetarian food when I die. I
Oh.
want like normal.
Yeah.
Or like the traditional, they'll have like just vegetarian. So I just go by because we're in Tainan. That's where all the nice like snack foods, street foods are. So I go to get whatever she liked when she
Yeah.
was still alive, and
Yeah.
then like this is what you like, and then like the soup, the
Mm.
noodles.
Mhm.
The neighbors come, and then we'll do like the folding paper money
Yeah.
thing, and then even though I'm Christian, with that 7 days, it helps to make me, process
Yeah.
grief.
Yeah.
And everybody comes and then say good things about my grandmother, and then we talk about what she was like, and that is so
Yeah.
important.
Yeah. Yeah, that's really missing in American culture, is like, oof, you know?
It's not only helping that you still remember this person, it really helps the person that are still there
Yeah.
to
Yeah.
do that inside your heart.
Yeah, 100%. Yep.
Yeah.
Yeah. What I find that surprised me is, a lot of times, if they're not actively dying, if they're not, like, sick, like, at the end, a lot of times their friends don't wanna participate. Yeah, they're like, "Ugh," they're like, "Why are you sick?" Like, it because it brings up their issues about
Oh,
death, or, like, wanting to avoid it, like, just like, oh, it just brought up something for them that they didn't want to participate, even though they're not the central figure. Yeah, I listen to near death experience podcasts all the time. I find it really relaxing.
Oh,
I really love it because what I love about near death experience podcasts is you hear from all different kind of people. So it's all like ages, walks of life. They all die different ways. Sometimes it's car accidents, sometimes it's a sickness, a drug overdose, whatever. But the universal thing is like no matter who they are, how they died, it just doesn't matter. They always pop out somewhere where they're met with like usually just love. They're just surrounded with love and this like non-judgment. And like even the ones that go through like, the life review process where they see all the all the mistakes they made, they always say like even then it never feels like judgment or like you're bad. It just feels like you're still loved. It's just like it just feels like you're reviewing like a lesson. Like, oh, what did you learn? Oh, what did you learn in school today? It just doesn't matter. It doesn't matter what their religion was. It doesn't matter. It doesn't matter. So it's just relaxing to just hear it so many times. And all those people that come back, none of them are afraid.
being dead is really that scary.
I don't worry about it at all anymore. Yeah. I
Just
think it'll be fun.
and just live every day the
Yeah.
best.
Well, thank you for inviting me.
Well, it was really interesting having you here, and I'm really happy that you shared so much and I learned so much. Would you want to try like some acupuncture?
Clear up.
Do you get any pain when I press down here?
A
It's a bit tight.
little bit.
So, the points I do, it's called the cheek acupuncture.
Mm.
So I don't need to put anything on the body,
Okay.
just across the cheek and just a few needles.
I don't think I've had cheek acupuncture
Before, feel any difference?
It feels better, like not as sensitive.
I'll leave these for a couple minutes.